stroke is a medical emergency that affects millions of people worldwide, and it is particularly common among the elderly. Recognizing the early warning signs of a stroke can mean the difference between life and death, or the difference between full recovery and permanent disability. For older adults and those who care for them, understanding these signs is crucial. In this narration, we'll explore the 5 early warning signs of stroke in the elderly. Delve into what happens during a stroke, why seniors are at higher risk, and what you can do if you suspect someone is having a stroke. By the end, you'll be armed with knowledge that could help save a life. To begin, let's understand what a stroke is. A stroke occurs when blood flow to a part of the brain is interrupted or severely reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die. There are 2 main types of stroke: ischemic, caused by a blockage in an artery, and hemorrhagic, caused by a blood vessel rupturing. Both types can lead to rapid and severe consequences. The elderly are more vulnerable due to age-related changes in blood vessels, higher rates of high blood pressure, and other risk factors such as diabetes and heart disease. Now let's look at the 5 most common early warning signs of stroke in older adults. The acronym FAST is often used to help remember some of the key symptoms: face drooping, arm weakness, speech difficulty, and time to call emergency services. However, strokes can present in other ways as well, especially in seniors, whose symptoms may be subtle or atypical. We'll discuss each sign in detail. The first warning sign is sudden numbness or weakness, especially on one side of the body. Imagine an elderly person sitting quietly at home. Suddenly, they notice their right arm feels heavy and numb. Their hand won't grasp objects as usual, or their leg feels so weak that they're unable to stand. This loss of sensation or strength may come on quickly and be accompanied by tingling. Sometimes, it's only noticed when trying to pick something up or walk across the room. In some cases, the weakness affects only the face, such as a drooping mouth, making it hard to smile evenly. The second early sign is confusion, trouble speaking, or understanding speech. Stroke can affect the parts of the brain responsible for language, resulting in slurred speech, difficulty finding words, or inability to understand what others are saying. A grandparent who is just chatting with family might suddenly start speaking incoherently or be unable to respond to simple questions. They might appear confused, unable to understand instructions, or complain that their thoughts are muddled. This symptom can be mistaken for normal aging or dementia, but its sudden onset is a major red flag. The third warning sign is sudden trouble seeing in one or both eyes. Vision changes are a lesser-known symptom of stroke, but they're common, especially in elderly patients. Sometimes, a senior may lose vision in one eye for a few moments, experience double vision, or see everything as blurry. They may complain that their vision went dark, or they're seeing only half of what's in front of them. These changes can be fleeting or persistent, and may be dismissed as just getting older or chalked up to needing new glasses. But if vision changes come on suddenly, stroke should be suspected. The fourth sign is sudden trouble walking, dizziness, loss of balance, or lack of coordination. The brain controls movement and balance, and when a stroke disrupts these areas, an older adult may stumble, lose their balance, or be unable to coordinate their arms and legs. They may feel vertigo, as if the room is spinning, or be unable to walk in a straight line. For seniors, who may already have mobility issues, this symptom can be tricky to spot. But if the change is abrupt and severe, it should be taken seriously. The fifth and final early warning sign is a sudden, severe headache with no known cause. While headaches are not as common in elderly stroke patients as in younger ones, they can be a sign of hemorrhagic stroke, where a blood vessel in the brain has ruptured. The pain may come on abruptly, feel intense, and be accompanied by vomiting, confusion, or loss of consciousness. If an older person complains of the worst headache of their life, especially if they don't usually suffer from headaches, it's an emergency. Let's recap these 5 early warning signs: sudden numbness or weakness on one side of the body, confusion or trouble speaking, sudden trouble seeing, sudden trouble walking or loss of balance, and sudden severe headache. Any of these symptoms, especially if they occur suddenly, require immediate attention. But why are strokes so dangerous for the elderly, and why is it so important to act fast? Time is brain. Every minute that passes during a stroke, up to 2 million brain cells can die. The longer the brain is deprived of oxygen, the greater the chance of permanent disability or death. Seniors are at increased risk not only because of aging blood vessels and higher rates of chronic health issues, but also because stroke symptoms in older adults are sometimes overlooked. They may not recognize the symptoms themselves, or caregivers may attribute changes to normal aging. That's why awareness and vigilance are key. There are also subtle or less common signs of stroke that can occur, especially in elderly patients. These include sudden confusion, personality changes, or altered consciousness, becoming drowsy or difficult to arouse. Some seniors may experience sudden incontinence, loss of memory, or a change in alertness. In rare cases, stroke can cause fainting, seizures, or even cardiac irregularities. Recognizing these symptoms is important, especially if they appear alongside the classic warning signs. If you suspect an elderly person is having a stroke, what should you do? First, call emergency services immediately. Do not wait to see if symptoms improve. Do not try to drive the person to the hospital yourself unless you have no other option. Paramedics are trained to begin treatment right away and can notify the hospital to prepare for the patient's arrival. Time is critical. While waiting for help, keep the person safe and comfortable. Reassure them and avoid giving them food, drink, or medications unless instructed by medical professionals. Once at the hospital, stroke treatment depends on the type of stroke and how quickly the patient arrives. For ischemic strokes, clot-busting drugs can be given within a few hours of symptom onset. For hemorrhagic strokes, surgery or other interventions may be needed to stop bleeding. The faster treatment is started, the better the chance for recovery. After a stroke, elderly patients may need rehabilitation to regain lost skills, such as physical therapy to improve movement, speech therapy for language problems, or occupational therapy to help with daily activities. Recovery can be slow and challenging, but many seniors regain significant function with the right support. Prevention is also important. Many strokes can be prevented by addressing risk factors common in the elderly. Regular checkups to control blood pressure, managing diabetes, quitting smoking, keeping cholesterol in check, and staying physically active can all reduce stroke risk. Taking medications as prescribed and following a healthy diet are key steps. For those with heart rhythm problems like atrial fibrillation, blood thinners may be recommended to prevent clots. Family members and caregivers play a vital role in stroke prevention and recognition. Knowing the warning signs, checking in regularly, and advocating for medical care can make a life-saving difference. If your loved one is elderly, encourage them to report any sudden changes in how they feel, and don't dismiss symptoms as just getting older. It's better to be safe and seek medical attention than to risk serious consequences. In addition to the physical signs, pay attention to changes in mood, behavior, or alertness. An older adult who is usually cheerful may become irritable, withdrawn, or confused. Sudden memory lapses, difficulty following conversations, or inability to perform familiar tasks can signal a stroke or another serious issue. If these changes occur abruptly, call for help. It's also important to recognize the impact of stroke on independence and quality of life. Seniors who survive a stroke may face challenges with mobility, self-care, and social interaction. Rehabilitation can help, but emotional support from family and friends is just as important. Depression and anxiety are common after stroke, and counseling or support groups can be valuable. Let's consider a few real-life scenarios. Imagine a grandmother who, while reading, suddenly cannot see out of her left eye. She's scared, but thinks it's just her glasses and waits to see if it passes. Luckily, her daughter notices and calls emergency services. At the hospital, doctors confirm she had a stroke, and timely treatment helps her recover her vision. In another case, an elderly man suddenly can't lift his coffee cup with his right hand. He tries to speak, but his words come out garbled. His wife, having seen stroke awareness campaigns, calls for help at once. Because treatment begins within the critical window, he regains speech and movement. Sometimes, the signs are less obvious. An older woman feels dizzy and stumbles while walking to the bathroom. Her son assumes she's just tired, but when she can't explain what happened, he calls for help. Quick action leads to early diagnosis and treatment. These stories highlight the importance of acting quickly. Even if you're unsure, it's better to call emergency services and let medical professionals evaluate the situation. False alarms are far less dangerous than ignoring a true stroke. Education is the key to reducing the burden of stroke. Community programs, senior centers, and healthcare providers can offer information and training on recognizing stroke symptoms. The more people know, the more lives can be saved. In summary, the 5 early warning signs of stroke in the elderly are sudden numbness or weakness, confusion or trouble speaking, sudden trouble seeing, sudden loss of balance or dizziness, and sudden severe headache. Recognizing these symptoms and acting fast is vital. Stroke is a leading cause of disability and death among seniors, but with quick action, the chances of survival and recovery are greatly improved. If you have elderly loved ones, talk to them about stroke. Encourage them to seek help for any sudden changes in how they feel, and don't hesitate to call emergency services if you suspect a stroke. Learn the FAST acronym and share it with friends and family. Face drooping, arm weakness, speech difficulty, time to call for help. By being aware, you can help protect your loved ones and give them the best chance at a healthy, independent life. Finally, stroke prevention is an ongoing process. Routine medical care, healthy lifestyle choices, and attention to warning signs can all reduce risk. For caregivers, staying informed and observant is essential. For seniors, speaking up about new symptoms and staying engaged with healthcare providers can make all the difference. Stroke doesn't discriminate by age, but the elderly are at highest risk. With knowledge, vigilance, and prompt action, we can work together to recognize the warning signs and respond effectively. Whether you're a senior, a caregiver, or a concerned friend, learning the early signs of stroke is one of the most valuable steps you can take in protecting yourself and those you love. Remember, when it comes to stroke, every minute counts. Stay alert, stay informed, and never hesitate to act.